Sharon, if you'd be kind enough to tell me, why do you think 1 in 6 couples in Northern Ireland are experiencing difficulties in the area of fertility?
Infertility basically involves can involve the woman and the man. So basically, you've got couples with a female problem, some couples with a male problem, and some couples unfortunately have a problem with both. It's the same figure on the UK mainland. It's 1 in 6 couples. There are 200 new referrals to the Regional Fertility Centre in Belfast every month. So that sort of gives you a bit more of a local feel on the figures. And basically, I think with couples, some of them are maybe leaving it a wee bit later on in life to have their family, to start their family, due to other work sort of life pressures. So the woman is maybe coming into her mid-30s when trying for a baby. And really, mid-30s can sometimes be the cut-off point for some women, depending on how their rates actually are sitting.
That later coming to the wish for a child in the 30s and maybe later, can that be concomitant with weaker sperm and weaker eggs?
It is more particular with the woman. The woman seems to be on a time clock more so than the man. So the woman basically is on a time clock. Women are born with so many eggs, and then over the years, the eggs are sort of released. So when it comes to sort of the mid-30s, the quality of her eggs can be different than they were maybe in her 20s. With a man, in some respects, men can reproduce, as they say, longer in life. But if a man has a particular problem with his sperm, that problem isn't going to go away. There can be certain procedures can be done, for example, ICSI. And ICSI is sort of a more advanced level than IVF in that one sperm is injected into an egg under very, very high microscope. And basically it's the best sperm got into the egg to give a better result and hopefully the couple achieving a pregnancy.
But of course that process takes away the competitive nature of the process, because the sperms at the beginning, before the ovulation occurs, or before the actual penetration of the egg occurs, the sperm, they're fighting to get there, and the stronger will win by a process of evolutionary practice.
Yes, I hear what you're saying, and there are so many new developments now with fertility clinics. We have a number of clinics in Northern Ireland here who do a lot of developments in terms of finding the best egg. But yes, that is the nature, the competitive nature of the sperm reaching the egg is compromised in those situations, and it really is the decision of the embryologist to choose the best sperm under microscopic conditions.
Yes, we can. It's wonderful technology. I'm smiling because we could all, if we were to do it all over again and be created all over again, we could wish in some extraordinary way to be in the hands of the greatest doctor there to make this fantastic selection. We could come out absolutely perfect human beings.
Well, in terms of the patients going through this, it really is not a very nice process going through IVF or ICSI. I wouldn't wish it on anyone.
Yes.
I have personally gone through it. I was very lucky that I got a little boy.
Ah, wonderful.
And I would not wish the process on anyone.
Yes.
It is a very, very daunting process. It involves regular injections on a daily basis, interferes with your normal mood patterns, interferes with your feelings, your emotions, and it does involve a stay in hospital, a short stay in hospital, a day procedure to remove the eggs. And although that's done under sort of local anaesthetic, it's not a nice process.
Well, thankfully, Sharon, it went well for you, and that's wonderful. But the case for other people maybe isn't always. Some people succeed, some people don't succeed, and that's where Infertility Network can step in, offer guidance, offer help, and maybe even campaign to get the government to take it more seriously.
Yes, Infertility Network UK, we have offices our main office is in England, in East Sussex, and we have regional offices in Northern Ireland, Scotland and Wales. And we basically are a charity set up to support the couple going through that very, very difficult emotional journey through infertility. We have support groups throughout the province, support groups in Craigavon and Belfast and in Derry, and we're actually running an information day on the 27th of September this year. So we really look for grant applications constantly to enable us to offer more services to people in Northern Ireland. And yes, on the lobbying side, we have an all-party group on infertility in Stormont.
So you have people in Northern Ireland, they, through the National Health Service, they're allowed one attempt.
Through the National Health Service, they're allowed one attempt, yes.
And if
I want to stress that.
If that doesn't work, they then have to pay for subsequent attempts at a cost of £5,000 or thereabouts a time.
That is very, very true. And looking at today's economic situation, where do couples find £5,000? I mean, a lot of the couples in our groups are having to remortgage houses, they're having to get into debt, and even with that debt, they go into the treatment cycle. If the treatment cycle is unsuccessful, they have nothing to show for that £5,000. I know couples in the debt who are in, in the groups who are in debt for thousands and thousands of pounds, but for this one thing that a lot of us take for granted, having a baby. Yeah.
What's the success rate percentage-wise in the first attempt resulting in a pregnancy?
Well, the Human Fertilisation Embryology Authority, who oversee fertility treatment, they would say that for every attempt of fertility treatment, IVF treatment or ICSI, it's about 25%.
Yes.
So it's a 1 in 4 chance for that couple fertility treatment, 1 in 4, which is not a very high statistic.
Yes.
And there's a lot of couples out there who are worked for them. But as you said earlier on, there are couples where even the one NHS treatment cycle is absolutely fabulous, and maybe they just needed that just extra support of sperm and the egg come together in the womb to produce the baby, and they needed that. So it's fantastic for those couples out there listening to this programme who maybe are waiting for that one NHS treatment cycle, because it can work first time round.
Well, people should be aware of Saturday the 27th of September, and we will keep referring to it on the programme. In Belfast, it's an information day, and it's what there's a small cost. It's £10 for patients, and people £20 for professionals. They can book online.
All our bookings are online. Yes, that's really just to help us with the administrative charges.
Yes.
And they book online through www.infertilitynetworkuk.com.
I'm going to repeat that for the people. Infertilitynetworkuk.com.
Yes, that's correct.
Look, you're doing wonderful work, and the World Health Organization recognizes infertility as a disease. And consequently, I rather think it should be treated as such by the NHS, and not just we're going to try once and then cast you adrift.
I fully agree with you. If it's been recognised by the World Health Organization, and not only that, the National Institute of Clinical Excellence guidelines, 2013 guidelines, recommends that couples get up to 3 cycles of IVF or ICSI treatment to give them their best chance of success.
Yes.
And we are lobbying for the Department of Health to recognise the NICE guidance and to take it on board. But the message we're getting at the moment, and it's like all the messages coming out of Stormont at the moment in relation to health, is that there isn't enough money. But we will keep lobbying there. We have to lobby for the patients who want it for a baby. They need to keep hearing our voice, and we won't go away until we get those 3 treatment cycles.
Yeah, for the life of me, I can't see Edwin Poots prioritising it, listening to the words that he's coming out with in relation to his overall budget. But I mean, isn't it dreadful that we need to be in this predicament where that which is demonstrably right and necessary is failing because there isn't sufficient NHS funding to do it?
I fully agree. I mean, the kind of figure that we're looking for to move to in treatment cycle, we're looking at maybe £3 million to move us through the process so that we can get couples even into a second NHS treatment cycle and eventually a third. So we're willing to look at the NHS doing a costing template for 2 treatment cycles in the interim. We're realistic. We realise that the health service is in a predicament at the moment, but we can't sit with 1 treatment cycle on the cards while the couples out there are just absolutely desperate for a baby, which many of us just take for granted.
Can I ask you about, you mentioned Scotland being very successful. We're all in the United Europe, we're the European Union. What's to stop Northern Ireland couples going to Scotland to have the treatment?
Well, they have to be living in Scotland. That's part of the criteria for the NHS treatment in Scotland, which makes it unfortunate that our couples can't go over to Scotland. They can go over to Scotland and utilise private clinics.
Yeah, sure, they could do that here.
The NHS.
They could do that here as well, couldn't they?
Yeah, we do have 2 private clinics we've set up in Belfast, and 2 excellent clinics. And that says it for itself, that private clinics are coming in because they know there are desperate couples out there.
Yes.
Looking for it. And choice is great. Choice is great for couples, but we would like more choice on the NHS.
Absolutely.
As well.
And when couples decide to go for the artificial approach, are they required to abstain from the natural approach just in case there's a confusion or one doesn't complement the other? Could they continue having normal intercourse and at the end, maybe by some great benefit from the gods, something would happen?
I think they need to listen to their consultant in that respect. There are different levels of fertility treatment. It's not all going to the highest level, which is IVF or ICSI treatment. There are couples who would be on Clomid, which is helping the woman to produce more eggs. So it depends on the level of fertility treatment the couples are going through, and each of those levels comes with its own sort of parameters around that in which the couple have to comply with. But I will say that when couples are going through the IVF itself, it's such daily injections, and as I say, the female maybe not feeling as well as she would like to be because it takes away her sense of well-being, some of the drugs. So that can have its own sort of downfalls in that respect.
Yes, yes. Sharon, it seems as I say, we'll keep referring to this, and I'll run the interview a couple of times. But is there someone in the medical profession, one of the doctors involved, who might agree to come on the program with me, and we can talk the finer detail of the medical situation, the most propitious circumstances for ensuring natural success and all of that kind of thing?
Well, we have asked some of the NHS doctors, and we had one doctor, Dr. Tommy Tang from the Regional Fertility Centre. He's coming along to our information day. So he may be happy to come on the programme and have a chat with you. Maybe
that's an introduction you could effect.
Okay. Yes, I'll send him a note and ask him.
Sharon, I want to thank you. You're a wonderful people, and good luck with your infertility network.
Thank you very much. Thank you. Very good interview.
All the best to you.
Thanks now. All the best.
Bye.
Bye.